Let's talk about your mouth and COVID-19. People with gum disease are more likely to get complications from COVID-19, according to a recent international study. Does that mean you should avoid your dentist to reduce the risk of contracting the disease, or should you get treated so that your gums are good and healthy to protect yourself? With more on this, we go to Douglas Hamilton, dentist at Westmount Dental Care, and full disclosure, he's my dentist and says I have the best teeth in the media. Dr. Hamilton, thanks for joining us.
Hey, Elias, how are you?
I'm doing well. So tell me about this, Dr. Hamilton. I'd heard for the longest time the gums are, sort of a gateway into the health of the whole body. What do we know here when it comes to COVID-19 and that mantra?
Right. Well, Elias, as you know, we've been talking about inflammation in the gums for years, and gum disease is an inflammatory sort of disease that causes the bacteria cause tissue inflammation, and you lose bone locally. Teeth get loose, they fall out. That's the local effect, gum disease, losing bone. But the inflammatory proteins that are there, that are generated, the inflammation factors that are in the tissues around the teeth, do get into the bloodstream, and they flow everywhere in the body. And for years, we've been talking about how it affects you in terms of pregnancy. It can be detrimental to pregnancy. They're linking it to diabetes, Alzheimer's, etc. So this idea of systemic inflammation coming from the gum tissue, because the gum tissue there's a lot of tissue there. If you strip out all the gums around your teeth, you have a piece of tissue about the size of the palm of your hand, which is bloody and pussy. Okay, so this is what gum disease is. And in COVID, as it attacks the lungs, is causing inflammation. But if the lungs are already primed with all the inflammatory proteins in the blood, then you're going to get an exaggerated response. So this is the theory. And so the McGill researcher that piloted this study, they took about 600 people and they compared their COVID experience with their gum disease or their level of gum disease. And they found a huge correlation. So if you have really bad gums and you get a serious COVID infection, your chances of being hospitalized are, in the ICU, it's about 3.5 times. The chances of being put on a ventilator is about 4.5 times normal, and the chances of you dying is about 9 times higher. So there seems to be a very strong correlation between the presence of gum disease and inflammation that it produces, and then bad disease outcomes with COVID-19.
We're with Dr. Doug Hamilton, dentist at Westmount Dental Care. We're going to get the COVID-19 numbers for Quebec just after the 11 o'clock news, so stay tuned for that. Dr. Hamilton, when it comes to gum disease, and pardon my ignorance here, is it fixable? Like, once the damage is done on your gums, can you regain it? Can you regrow your gums? How does it work there? I really don't know.
Well, okay, so it's local factors and there are systemic factors. So some people are more prone to gum disease than others, and people that smoke will have more gum breakdown than people that don't smoke. There may be genetic factors, but overall, really, most of it is really about removing the local factors. So the bacterial slime, we call it bacterial biofilm, that's the plaque on the teeth below the gum line, release the toxins. If we remove that on a regular basis, and it seems to be about every 3 months is often enough for people with gum disease, if we can get you in for a cleaning and clean all that out with ultrasonics on a regular basis, and then we have you brushing and flossing properly with good technique at home, we can eliminate the bleeding. That's the marker for disease. So if you're brushing and flossing at home and there's blood there, then you're not clean enough. You have to step it up at home and maybe be seen by the dentist. You can check with your dentist or periodontist to how often you should be there. But if they're doing a cleaning on you and every time you come in there's bleeding, that means you've got local inflammation and you're not getting treated enough. But if we do have good treatment, it will clear up pretty quickly.
Okay, I want to get to that bleeding in the mouth, Dr. Hamilton, because, and I come to you and get a cleaning at your clinic every 3 months, and that's because I for some reason I like going to the dentist. But for people at home, if they sometimes even when I floss, every now and again I'll have a little bit of blood, right? And I don't know if that's because I've cut my gums or whatever, but so when we're talking about the blood that we get when we're brushing, what's the warning sign here we should be really looking at?
So bleeding comes because of local inflammation most of the time. Now, sometimes that's because there may be a filling or something that doesn't fit right, and it causes the collection of plaque, and then you get a reaction in the tissue. Other times it may be that your technique is not doing the job that you need to do, and you need to improve your technique, or you're not going to get the hygienist to clean things out often enough. But if you have bleeding, that means you have local inflammation. But most of us would know that if we floss and there's a bit of bleeding, we know that we haven't done it that often, so we step it up and do it more frequently. Maybe we step up to twice a day, or we just do it every day, and then the bleeding usually goes right away. The same with brushing with good technique. Usually this will clear up right away with good home care. So I don't think the whole public has to panic about having a little bit of blood on their floss, but if they step it up, they will get a reaction pretty quickly, a healthy reaction from the tissue.
Dr. Doug Hamilton, dentist at Westmount Dental Care. It's always fun talking teeth with you. Thanks for coming on the show.
You're welcome.